Well, spring is, of course, the season of renewal. However, if you suffer from irritable bowel syndrome with constipation or chronic idiopathic constipation, it may be hard to focus on health as well as your well-being. Dr. Jack Braha and patient Blanca Escarcega are here to talk about these conditions. Welcome.
Thank you for having us. Good morning.
Thank you.
Absolutely. Let's talk a little bit about IBS-C and CIC. Tell us what it is for people who don't know.
Well, IBS-C and CIC are both digestive disorders, diseases that folks suffer from associated with constipation. There's a difference between the two in that irritable bowel syndrome, IBS-C, is associated with unexplained abdominal pains, discomforts, or aches that folks have in coordination or in conjunction with changes in bowel habits, in this case constipation. CIC folks, patients suffering from this, describe hard stools, difficult to pass stools. And these conditions are so common. Up to 35 million people thought to have CIC and 13 million have IBS-C. And what's important about those numbers is, unfortunately, about 75% of folks with this have yet to be diagnosed or treated, and there are treatment options available for them.
Well, I think it's uncomfortable for a lot of people to even start the conversation, and that's why I wonder, Blanca, what prompted you to finally talk to your physician about your symptoms?
Honestly, for me, it was my family. It was the last time that I had with my family where there would be times we'd be sitting there watching a movie and they have to pause the movie for me to go to the restroom. I'd be in the restroom sometimes 4 to 5 times a day, up to an hour at a time, and with that, and undiagnosed for 9 to 10 years, it was something that where I had had enough. I needed to have that conversation and get over the embarrassment of seeing my doctor.
What steps did you take to manage the problems you were having once you were diagnosed on a daily basis?
Great question. So, as my doctor suggested, the very first thing I started with is changing up my habits. So I changed up the amount of fiber intake. I increased that. I increased my water intake, changed my diet, my exercise regimen. And when those didn't help, I was prescribed Linzess, where I take Linzess once daily, and it is absolutely helping me to get ahead of those symptoms and kind of start managing my life the way I want to.
Doctor, what advice would you give to adults who think they may have this problem?
Well, the first step with any of these symptoms is to first see your physician and see what your physician feels about them. And do you have IBS-C, CIC, or another condition? Because your doctor can offer you treatment options. And as Blanca mentioned, diet, lifestyle, there are over-the-counter remedies, prescription drugs like Linzess, as she mentioned, are very important in our tools to fight this disease. Folks need to be empowered and feel comfortable in talking with their physician. Linzess is a once-a-day proactive treatment that she is taking, Blanca, and has found success with. And as with any of the treatments we talk about with our patients, we have to talk about the side effects. With Linzess, the most common side effect was diarrhea, and that's why it's important to follow up. Whatever your physician chooses for you, if it's not working, follow up. There are other options. If there are side effects, to speak with your physician. This has to be a good effort between patient and provider, and no one should feel uncomfortable talking about these symptoms.
Where can people go for more information? So obviously you're recommending that they talk to their physician, start the conversation, but if people want to do a little research on their own, what do you suggest there?
Well, yes, there are some great resources out there, one being Linzess, linzess.com, where there are some great resources provided for patients to talk about their symptoms, see about their symptoms, and look for possible treatment options.
Thank you both so much for joining us to talk about this. We appreciate your time.
Thank you so much.
Thank you.